I get a lot of calls about brachial plexus injuries. Can you explain what they are?
Sure. The nerves that come out of the top part of your neck run out your shoulder and down your arm, and they are the nerves that allow us to move our arms, our fingers, our hands. If those nerves are damaged during childbirth, which is where we see most brachial plexus injuries, it results in paralysis of that particular arm. Very serious injury, usually very devastating.
How does it happen?
During childbirth is where we see most of them, and occasionally as the child is being delivered, his or her shoulder will get stuck. Physicians are trained to use several maneuvers to free up the shoulder, but occasionally the maneuver they resort to is lateral traction on the child's head, pulling it to the side. If you exert too much force on the child's head, you will stretch these nerves and frequently even rupture them as they come out of the spine and go out into the shoulder.
So what would be some prevention methods for the doctors delivering the babies?
There are a number of maneuvers that doctors are trained to use. They have a bunch of different names. They're named after the physicians that developed the maneuvers. But the most important of them is for the doctor not to panic, because once he or she does that, then they kind of lose sight of the big picture, and that lateral pulling on the head becomes very easy to do.
So they should make a decision at some point between vaginal delivery and C-section.
Yeah, that it's not that easy. The C-sections are surgeries. They're a big deal, and so most obstetrician gynecologists like to avoid them. In lots of ladies who are pregnant, the need for a C-section is quite predictable. But the vast majority of the brachial plexus injuries we see are not presentations that clearly called for a C-section. Hindsight, sure, a C-section would have avoided the injury.
And are these typically larger babies that result in these injuries?
Usually, the size of the child certainly contributes to this thing I was describing earlier of the shoulder getting stuck. It's called a shoulder dystocia. We see them in smaller babies, but far more frequently in a larger child.
And is there anything the mother can do?
Not really. At this point in time, the mother is 110% invested in pushing, because the injury happens as the child is being delivered. And so other than follow the instructions from the doctors and the nurses that are trying to help her deliver the child, she's really, doesn't have a whole lot of input into preventing the injury or doing anything to stop it.
And you recently tried one of these cases, didn't you?
In the last 2 years, we've actually tried 3. All 3 of them have resulted in multi-million-dollar verdicts, which is certainly good for the families that we represent, but it also reflects just how horrible these injuries are and how devastating they are.
All right, thanks.
Sure.
For a free confidential consultation with one of our experienced injury attorneys, call our toll-free number or fill out a quick contact form today.